Hi everyone, welcome to my channel. This is Life with Adi. I just realized I didn't have an intro for this video, so I wanted to come up on here and do an intro for you guys. I did get one question, yay, on my YouTube channel, and the question read, let me go back on there. Hi everyone, welcome to my channel. Do an intro for you. The question is from Amy Bridge, and she asked me, could you answer a question in your next video? Have you had any embarrassing, funny TMI symptoms like a lot of gas farting during your pregnancy? And the question, the answer is yes. And this pregnancy I did. Actually, I'm gonna look up to see when I posted or not in my Facebook or somewhere. I must have posted on my Snapchat or Facebook, but I actually had a lot of gas, and it was causing me a lot of pain, like a lot of pain. So I had to go to the ER because it was coming to the point where I was pooping and vomiting at the same time. So I literally was having diarrhea and had the trash can in front of me while I was having diarrhea. So I was vomiting and pooping at the same time. And so I had to go to the ER, and so then I had to go to the ER, and they prescribed me, they told me to get Gas X and Iridium for the diarrhea, and Gas X for the gas. And it helped me that day. Everything was making me nauseous that day. All the food, water, everything. So yeah, I had to go because it was so much pain that it wasn't like contraction pains. I knew they weren't contraction pains because I've had contraction pains, but they were awful pains, and they were nauseous, and I don't like feeling nauseous. I know nobody likes feeling nauseous, and it was scary to the point where literally I was pooping and vomiting at the same time. So yeah, that was pretty embarrassing, but nothing can top my second pregnancy when I was giving birth and I was pooping. Yeah, I think that's pretty worse when you're giving birth. And then I asked the nurse, am I pooping? And she's like, no. I asked the nurse if I was pooping, and she said no, but she was wiping me, so obviously, yeah, that was pretty embarrassing. But yeah, of course, I have a lot of, even right now, I have to wear a pad 24/7 because my baby, my babies are pretty crazy. But yeah, even right now I have to wear a pad because I have, what is it? When your bladder's kind of low, so then every time you sneeze, you pee. So I be sneezing all the time. So yeah, that's pretty embarrassing too. And that's going to happen to me even after I have the baby because my bladder, I need to fix my bladder and move it up. But yeah. Collecting my urine. Okay, everyone. So I have been collecting my urine for the full 24 hours, and I pee quite a bit. So I have to pour it in here. And so let's see if it'll fit, because I think I pee too much. Okay. Okay, so that's it. I collected my 24-hour urine. Now I have to go turn in the jug to the lab and they draw my blood.
I don't want to see
Okay.
that. I don't want to see
Stop.
that. But I want you to.
Okay, everyone. So I did the 24-hour urine and I turned it in just right now. And they took out my blood. And I they took out my blood. It hurt. But oh well. It is what it is. We're gonna eat some lunch now, and so then I'll update you guys on my results. So that I have to do, because I'm high risk, and because it's high risk of my blood pressure affected my kidneys, so my kidneys don't work as well. So I do think that the blood pressure pills have improved my kidneys, because my second pregnancy, my protein levels in my urine were in the 1,000 range, and I'll insert a clip of that. Okay, so Okay, my first trimester, my levels of my kidneys, my protein level, this exam was done on September 10th of 2019. That was my first time collecting urine for this third pregnancy. So my levels were at 444, and that is considered high. Normal ranges should be between 30 to 150. So mine was at 444. So the second trimester, I did another 24-hour urine analysis. That one was at 306, and that date was December 7th of 2019, and that was at 306. Stop, Matthew. Stop it, baby. Stop it. My baby. I'll show you my baby in a little bit. Okay, so the third trimester. Shh. The third trimester, my protein levels were, so my second trimester were at 306, and my third trimester, which was done March 11th of 2020, they were at 612. So it nearly doubled. And that's because when you're in your third trimester, at least at my hospital, they try to alternate you to see different OBGYNs. That way you become familiarized, just in case that your doctor is not the one that delivers your baby, and you get to meet these individuals. So the OBGYN that I had, she told me my levels were the same because I just did my urine analysis. She told me my levels were the same and not to be concerned. But yet when I went to my maternal medicine appointment, which was just yesterday, they did tell me that my protein levels had doubled. So that is a concern. And so therefore, when I see my doctor on Monday, I'll see my regular doctor, and they're gonna do like the test where they insert like a Q-tip inside your butt. Not in your butt, they just like clean it or whatever, and they check for other STDs. Then they're gonna check my private area, my lady part, as well. Probably they're gonna check to see if I'm a little dilated or not, and then they have to do another blood test. So yeah. So I'm going to talk to her about the protein being 612. I do notice that now my blood pressure is a little bit harder to stabilize with the Labetal that I'm on. I'm on 200 milligrams twice a day, and I take a baby aspirin, which is 81 milligrams. They told me that I need to stop taking the baby aspirin at 37 weeks. Usually I do deliver babies. All my sons have been delivered at 37 weeks. My first son, Mason, was delivered a day short from 38 weeks, so I almost would have made it to 38 weeks. Matthew was delivered at... Stop, Matthew! No! Matthew was delivered at 37 weeks on the dot. Like, he was, like, right on the dot. As mentioned, my previous pregnancy with Matthew, I was at the 1,000 range of my protein in my urine. Like, that was really high. So I do think that now that after I had Matthew, and then they prescribed me some high blood pressure pills, I think that it helped my kidneys. They didn't get damaged as more damaged. So yeah. So this is my update for the urine analysis. I am going to do a video, and I'm going to shoot it today just because I already have my camera set up and everything. And I do want to shoot another video. This one is going to be what's in my diaper bag. So, yeah. So this is the makeup look that I did today. We are in quarantine mode, so we are not able to leave. So anyways, this is going to be just because. I need my my baby boy. I am 34 weeks and 5 days. 5 days. But my baby does measure more. And he weighs 5 pounds and 6 ounces. So he already surpasses my second pregnancy, because Matthew was born 5 pounds 3 ounces. But you wouldn't even tell. He's super big. I mean, not like super, super big, but here he is. Hey, Matthew, look. Hi, say hi.
I bet.
Say hi, baby.
Mom.
What? So this is Matthew. He is 2 years old. He has curly hair like his mama. And he likes to be crazy. I'll just put him right here. But yeah, that's my second son, Matthew, who is 2. And he's the one that kind of like it helped me being pregnant with him, because then that's when they knew about my blood pressure. And they prescribed me pills afterwards. So yeah. Oh, let me show you my belly bump. Let me move this a little bit further. Okay. So this is huge, guys. This is huge, and it hurts so much when I get up. I get like a lot of pain right here, and it hurts. And I don't like sleeping, because it even no matter if I sleep on my side or my back, I wake up with a bunch of pain right here, and I'm in pain walking. But yeah, this is my pregnancy bump. But yes, it is huge, huge, huge. Okay, and I have to pee already. But yes, I did want to do my urine analysis. I am going to insert clips of collecting the urine. I did this back in March, and it's already March 20 something. I just so busy with these kids, like, and now with the quarantine and then nesting, I've been cleaning Matthew's room. Is now going to be the baby's room, and he sleeps with us now, which is not good. I do want to move him to Mason's room, my firstborn. But yeah, like this. Yeah. Yep. It's pretty hectic. If you guys have any questions, you can definitely leave them in the comments. You can subscribe. The more the subscribers that I have, I think I'll feel more excited. Well, yeah, I am excited to post a video, but more like more connection with you guys. If you want to comment, leave any comments in there. Any updates that you guys want to know, like. Okay, another update is that my husband did tell me that we could have another baby. He could probably be just saying that, like, he doesn't really want to have another baby. Maybe he just wanted to make me happy. I don't know. But I do want to have a baby girl. Like you guys know, this is my 3rd pregnancy with a boy. I'm still not over it. But I have to accept it. Because they're not so far in ages, I still have some of Matthew's clothes, so I am going to be using his clothes for this baby. I'm so tired. I'm so tired. But yeah, I did want to, so hopefully I can edit this video today, which is March 27th. And I didn't even know it was a Friday, March 27th. And then I want to videotape the one for the diaper bag as well. Like what's in my diaper bag. Alright, so here we go. I'm going to go ahead and end the video. And stay tuned. Leave comments if you're watching. Tell me hi. Ask any comments. If you're also suffering like me with high blood pressure. And you're scared. Hopefully, I can deliver. So if I'm 34 in 5 days, hopefully in 2 weeks or more, I can have this baby already. Because it's pretty painful, like, to be carrying a baby. I'm actually looking forward to giving birth, and the pain will be just that day, and then it's over. Like, no more pain, you know, carrying a baby. But yeah. All right, bye guys.